Cataract is the most commonly known eye disease. But apart from cataract, if we are asked which are the most commonly known or diagnosed eye diseases, do we have an answer to this? I was diagnosed with macular degeneration or Stargardt disease when I was a kid. My parents had no idea of what it was. People around us had never heard of this disease. I believe lack of awareness is due to lack of communication and lack of knowledge. Today we have with us Dr. Moraes, an ophthalmologist, someone I have known for 25 years. She was the first doctor among the many I met who diagnosed my condition when I was a kid and helped me and my parents understand what I was going through. Dr. Moraes completed her post-graduation, that's MS, in the year 1982 from Bombay University. She worked with the DHS as a surgeon for 18 years, and after her voluntary retirement, she still continues to practice in her own setup in South Goa. Before we dive straight into the episode, a humble request. Do like, share and subscribe to our channel. Leave us your comments in the comment box to help us get better and grow. This is an episode with Dr. Moraes to help us learn and understand eye diseases on the People Tree Show. See you on the other side. Hello Dr. Moraes, how are you today?
Oh, I'm good.
Very warm welcome to the People Tree Show. I'm really excited actually to have you here because when I was thinking of our journey together, can you believe it? It's 25 years.
Yeah, I can believe. Because I kept telling people that she was so small when I first met her. Yeah.
Yes. So doctor, today we are discussing about eye diseases because when I was diagnosed with my eye disease, not everyone knew about it, and even today I feel not too many people are aware of the eye diseases which are there. So to begin with, what are the most common eye diseases which are diagnosed in kids and in adults? So we'll start with kids.
Okay. So according to me, I would say that most common is the refractive errors.
Okay.
That is wearing glasses.
Okay.
Especially myopia.
Okay.
There are two types of refractive errors in children.
Okay.
Rather three, I would say. That one is myopia. It's also called short-sightedness, where the children cannot see far away objects. They can see near. There's something called hypermetropia.
Okay.
Okay. Hypermetropia is the eyeball is smaller than normal. So they see far and they also see near, but they have a lot of strain.
Okay.
And that is a little dangerous type of disease because most of the time people don't know that they have hypermetropia.
Okay.
Myopia is easy because they don't see the blackboard.
Okay.
The teachers notice it, the friends notice, the parents notice because they go very close to the TV. They keep their books very close to their face. So that usually the parent will bring earlier. But in hypermetropia, especially sometimes it's only one-sided.
Okay.
So the child will see everything with one eye, and the other eye goes something called amblyopia or lazy eye. And hardly it can be corrected. So that's why we advise parents that they should bring the child early.
Okay.
I don't know whether you have seen, but sometimes we patch one eye.
Yes, yes,
okay?
I've observed that.
And with the parents bringing early, patching, correcting, almost 100% results are good.
Okay.
Then there's something called astigmatism.
Okay.
Astigmatism can be with myopia and hypermetropia.
Okay.
There is the cornea is involved.
Okay.
The cornea is the outer dome, the transparent dome. That has a different shape rather than size. In myopia, the eyeball is bigger.
Okay.
And it keeps growing.
Oh.
Okay. In hypermetropia, it actually becomes smaller as the child grows.
Oh.
But it has to be caught at an early age.
Okay.
Otherwise, they lose one eye most of the time.
Okay.
Now, astigmatism is irregularities in the cornea. So it sometimes it's combined with myopia, hypermetropia, but it can be corrected.
Okay.
So that is one thing. But nowadays more children come with eye strain
Okay.
because of mobile, which I am very much against actually. Yeah, actually parents come to tell us, I want to know whether my child has a number,
Okay.
because whole day he is on the mobile.
Mm-hmm.
In fact, that is not correct. Today morning itself I told one patient, never bring your child when they don't have a symptom. You know what they do actually? They'll say, doctor, just see if he has a number. The whole day he is on mobile.
Okay.
I tell them if he doesn't have a number, then he is going back home and telling you, so the mobile has not given me a number.
Right.
So I will still see. So don't put in the child's head, it's never due to mobile. You'll never get a number because of mobile. You may get a strain,
Okay.
because of that. They'll have watering, then they can't face the light. So that is the most common symptom nowadays people come.
And
with the
what
children.
about adults?
No, adults is the normal number. Adults for centuries had that number.
Right.
Like as you grow older, your lens, the lenticular lens, what we have lens, that gets hardened.
Okay.
So once that gets hardened, then you can't see reading.
Okay.
So that will come not as a disease. That's like a natural process.
Natural process.
I would say. But besides that, children, of course, that's the most important. And then you have injuries, common. But nowadays, I would rather say when I was much, many years back, there were a lot of injuries. Now injuries have become quite less in children.
Okay.
Probably parents are overprotective.
Yes.
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 And allergies. Allergies are very common in children. There's one type of allergy we call as vernal catarrh.
Okay.
Or seasonal catarrh.
Okay.
It's very common. Sometimes I have 10 patients in a day with that same disease, and that comes from 5 years to around 15, 16.
Okay.
After that it goes off.
And what it is, doctor, if you could explain what
Yeah,
is.
that only the eye will be red and itchy.
Okay.
Okay. Now sometimes they get small white dots in between the cornea and the sclera. The sclera is the white portion.
Okay.
The cornea is the black. So at the junction you will get small spots. And sometimes parents also don't bring them early. They'll wait till it's very bad.
Okay.
If they come early, within a day or two they improve. But it is seasonal, especially in the winter season.
Okay.
That's one very common in children.
Okay.
Understood, no?
Yes.
And say small things like when a pencil pokes, they'll get a hemorrhage in the eye.
Okay.
Like that. Now, if you want to know about congenital disease in children,
Yes, I would.
yeah.
If you could elaborate.
Actually, congenital disease quite rare, luckily. There used to be something called premature children were born, no?
Yes.
So they used to get retinopathy.
Okay.
Retinopathy of prematurity. Because of the oxygen which they used to give when a baby is born, they used to put in the incubator.
Okay.
So that got a lot of fibrosis inside the eye. But nowadays that also is taken care. So we don't see many. There's one condition called retinoblastoma.
Okay.
That is a cancerous tumor in children.
Okay.
Very rare.
Okay.
Okay. But it's very easy to diagnose.
Okay.
The parents themselves will tell you that I can see something white glow like that of a cat's glow, how you see in the night the cat's eye. They themselves will come and see, I can see some glow.
Okay.
That is very dangerous.
Okay.
And sometimes it is bilateral.
Okay.
I had 1 or 2 patients, very unfortunate, the eye has to be removed there.
Oh my God.
Yeah, but not only that, sometimes they have in the other eye small seedlings.
Okay.
That is one from childhood, I mean from birth
From
it can
birth.
come.
Okay.
Understood? No?
Doctor, if you could explain what is retinopathy? Like.
No, now retinopathy, as you say, it can be in children and in adults, like diabetic retinopathy in adults. But in children, this is the blood vessels grow. In the retina, there are a lot of blood vessels which will break. Then there will be hemorrhages, there will be something called exudates, and there's pulling of the retina.
Okay.
Okay, scarring. So that we call all diseases of the retina we will call as retinopathies.
Okay. Okay.
But that retinopathy depends on what kind of retinopathy.
Okay.
Like the juvenile retinopathy,
Okay.
what you say have. I didn't want to mention that.
So doctor, the retinopathy in adults, so if you could explain that.
Okay. Retinopathy is anything to do with the retina. Most common is nowadays, and of course, diabetic retinopathy in adults. Also, hypertensive retinopathy is there, but compared to diabetic, it's much rarer.
Okay.
Okay. Now, what happens in diabetic retinopathy is when your sugar levels are high, and it's the number of years. Like if a 30-year-old person gets diabetic retinopathy, within 10 years, 30% he's blind.
Oh, okay.
And by 60 years, 50% blind.
Oh,
Okay. So it's the number of years of having diabetes, uncontrolled diabetes, which matters. You can have diabetes even for 20 years, but if it's well controlled, nothing happens to your retina.
okay.
Okay. So every year, once you have diabetes, we tell them to check your retina.
Okay.
But of course, first 5 years, I feel it's quite safe. We have never seen much in the first 5 years. After 8 to 10 years, everybody will have a diabetic retinopathy.
Okay.
Okay. But there are stages of it.
Okay.
Like 4 stages we would grade. In the first stage, maybe you won't even know you have. Okay. On routine examination, like when we see the fundus, we dilate the fundus in the
Right.
pupil and we see inside. That time you see small dot-like hemorrhages.
Okay.
But actually before the dot-like hemorrhages also, you can see something physiological which is not seen by us. So we still think it is normal. Understood, no?
Yeah.
The oxygen supply to the eye is less once there is diabetic retinopathy.
Okay.
There are a lot of factors. The blood vessels become, the thin, you won't know that much, but say thickening of the blood vessels. Then the blood itself becomes sticky, not flowing that easily. So you will get small blocks, or we call them aneurysms,
Okay.
which sometimes we may not notice also on fundus examination. So that is like the first stage.
Okay.
After some years, those small spots will break.
Okay.
And they will form dots and blots. They are typically called like dots and blots hemorrhages.
Okay.
You will see small dots all around.
Uh-huh.
Okay, and few exudates. They are white spots. Those will be red and these will be white.
Okay.
Okay, so then the third stage comes with lot of exudates. The same thing continues because you have not done anything much for it. No?
Right.
And the fourth stage is when these sometimes the big hemorrhage will occur.
Okay.
And these big hemorrhages will pull your retina.
Oh.
There will be scarring and that's called traction detachment.
Okay.
Okay. Then they can get a detachment. So, but if you control the first stage, and now treatment is there, you can just put a argon laser and burn those spots.
Okay.
Now, why these hemorrhages occur is because when there are small blocks, something called neovascularization occur.
Okay.
New blood vessels form to supply oxygen for your eye.
Oh.
That is nature's this, no? Anyway, something is blocked, new blood. And those new blood vessels are very delicate.
Okay.
So they keep on breaking. And it's the breaking and causing blood spoils the retina, that much area.
Okay.
Understood, no? So you can't see, especially if it occurs at the macula.
Oh.
And these hemorrhages first occurs in the mid periphery.
Okay.
Understood, no, of the retina. See, the optic nerve is there, periphery is there. So in between it forms. So still people feel they okay. Even second stage, sometimes even we don't say in second stage, we say, okay, you can wait. But preferably second stage you should do that.
Okay.
Understood, no. Now hypertensive with high blood pressure, there also, that is also retinopathy, but their blood vessels become very narrow, arteries.
Okay.
Arteries become very narrow, the blood supply again doesn't. But there you will get big hemorrhages, very close to this is actually more of a medical rather than lay people. They will have hemorrhages very close to the arteries.
Okay.
And they are called flame shaped. So they will be like a big, from there we can diagnose whether it is diabetic or it is hypertensive.
Okay.
But mostly in hypertension, just like in heart attacks, I always tell my patients it's like a heart attack.
Oh.
Only thing it has occurred in the eye. Okay, when it occurs in the heart, you are so worried. When it occurs in the eye, you are blind.
Right,
No, yeah.
right.
So sometimes occlusion of the major blood vessels, and then you are blind.
Okay.
And still, really, there is no treatment. Sometimes a vein can block. So once a vein blocks, there will be massive hemorrhages. The whole retina is full of blood.
Okay.
Okay, now even if that blood gets absorbed, the underlying retina is already destroyed. And there is something called macular edema.
Okay.
So when so much of hemorrhage occurs, there is only one point in the eye which is the most essential for us, that is called macula. And with that we see central vision. Understood, no? So that gets very much swollen. CME we call, central macular edema.
Okay.
So that is one reason why you this.
Okay. Okay.
There are other retinopathies like that, you know, due to other disease, due to syphilis, gonorrhea, AIDS, my God, so common. Big patches you will see. So that's how you have to only diagnose with the blood test and all that.
Okay. 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 So, doctor, now we move to my condition.
Okay.
So, macular degeneration and the most commonly known macular degeneration and retina pigmentosa. So, if you could explain what is macular degeneration, then we move to retina pigmentosa.
Okay. Actually, macular degeneration also is in adults and it's more common in adults. There is a dry macular degeneration where the macula, as I told you, no, there's only one point which we see.
Yeah.
That specially exposed to the sun. So that's why these foreigners, mostly who are fair, their pupils dilate more. And I don't know if you know anything about not to see the eclipse.
Yes, I know.
Because when we see the eclipse, we see directly the sun. Okay, and that heat is so strong that it burns your macula.
Oh, okay.
Yes, that is why we tell you not to see. So that is one where there you will get a macular degeneration, and later on a macular hole also.
Okay.
Because macular, because it burns. So when it burns, it's like, see, wherever you get a burn, you will get a blister.
Yeah, a blister.
Like that, you will get a blister. That blister will break and form a macular hole.
Okay.
And that's a very rare. Now, of course, they still operate for the macular hole also. But all these retinal surgeries are complicated. No guarantee.
What about macular degeneration when it starts from juvenile?
Yes. So now there is, unfortunately, there is something called juvenile macular degeneration that actually from birth, nobody knows the cause.
Yeah.
It's not only macular, it is choroidomacular.
Okay.
Yeah, it's, see, macular degeneration, macula is such a small point. So you should have been seeing something from the side. No, this is all over.
Okay.
Mid periphery, understood?
Yeah,
no?
right.
That is, it's a recessive disease. Mostly come from your family somewhere far. Autosomal recessive, no treatment. And there you get only exudates. Your whole retina will be whitish in color.
Okay.
Like exudates are like cotton balls. Okay. In a normal person, if the exudates are there, the body removes them.
Okay.
On their own. But here you don't have that ability to remove those exudates. So the exudates remain.
Okay.
So most of the people will progress, but fortunately, like I would say even you, some people they don't progress much. Until now there is no treatment. So when you see your retina, no, it will be all white patches. There is no blood supply, optic atrophy, even the optic nerve, because when there is no blood supply, your nerve also gets white. That's called optic atrophy.
Okay.
Yeah.
And
But it sometimes stops. Who knows? Almighty knows.
I'm lucky.
Stops. Yeah.
I'm lucky.
Yeah. But it's a very rare condition.
Yeah.
It's also called Stanford 1 disease. Like heredomacular degeneration. There's so many there, but they are grouped into one, like juvenile macular degenerations. Understood? No?
Yeah. And what about retina pigmentosa, doctor?
That also is a hereditary disease. Again, recessive genes. Okay. Very rare, fortunately, very, very rare. But there, we have some cells in the retina called rods and cones. Now cones are for color blindness,
Yeah.
and rods are for night blindness. But in retinitis pigmentosa, both are affected.
Okay.
Okay, more the rods.
Oh.
Rods are meant for night vision. So here no rods are there.
Right.
Okay, so but there are people, they don't have rods, but they don't have retinitis pigmentosa. There are many people who don't see in the night.
Right.
But in retinitis pigmentosa, you will get small like bony spicules, you know, like small bone pieces, black in color, and they start at the mid periphery.
Oh.
I keep on saying that because here is the nerve, here is the periphery. So actually they start in the middle. So initially you don't come to know. Like it will start in adults by 20 years. But still people are good, their vision is good, they can still, only little night blindness they'll have.
Okay.
And with age, by 60, you are very bad. Because those spicules occur everywhere, which were only in the middle, they come forward this way, forward this way. Plus they get optic atrophy, and then later they can get a cataract. So these three things, I had people. So in the end, they have something called only tubular vision.
Okay. What is
You have to,
tubular?
yeah, tubular vision is like as if you are looking through a tube.
Oh. Okay.
Okay, you don't see anything by the sides.
Oh.
So they can fall, accidents and all. They walk also like this because they can see only the center.
Okay.
Tubular vision. So that's why it's called tubular vision.
Okay. So, doctor, what I would like to know next is what is retina detachment, and how can we help, or y'all can help such patients?
Difficult question. First of all, about the second one.
Okay.
How can you help? Retinal detachment. We have something called retina at the back of the eyeball. Just like in front, how you have cornea, iris, the lens. The whole remaining part of the eye at the back eyeball is surrounded by a very, very delicate membrane, and the most sensitive one is the retina.
Okay.
Now that retina is a very thin membrane, but it is made up of 10 layers.
Okay.
Okay, like I was telling you, some are with rods, some are with cone, all those sensitive things are in the retina.
Okay.
Okay, now detachment is mostly occur between the first two layers and the last. It's like 10 layers are there.
Yeah.
Imagine a book, pages. So 2 are bound together and the remaining 8 are sort of bound together.
Okay.
So between the 2 and the 8, it's the adhesions are little looser.
Okay.
So whenever detachment occurs, it will occur between these 2 and the 8.
Okay.
So the first 2 that they are, which are towards the eyeball, not at the periphery.
Okay.
So they will get detached.
Oh.
So it's like anything is there and 2 layers come out, they'll become loose and they'll come forward. Okay. So there is like total detachment sometimes. The whole this layer will come. Sometimes it's partial. But it usually occurs like with trauma, very severe trauma, where you may get a cut in the retina.
Oh. Okay.
Okay. Once there's a cut, the fluid which is there in front of your eyeball, there's a fluid called vitreous.
Okay.
Okay. It's like a
Egg white.
egg white, that thickness. So usually if it is that good, it is not supposed to have, because it keeps the retina pushed back.
Okay.
Understood, no? The egg white keeps the retina pushed and together.
Okay.
So now if your egg white sometimes become watery, that's called, we say it from gel to sol, the jelly into solution. So those people have more chances of getting detachment.
Okay.
Like suppose you have a small tear, then that's water, we'll say as solution, will go sip through that hole.
Oh.
And then it goes on peeling off.
Okay.
Understood. It's also very common with high myopes.
Okay.
Very high, like see people who wear very thick glasses.
Okay.
For the lay people, let them understand. Those who wear very high glasses, minus glasses, they are called high myopic people.
Okay.
Now their eyeball is bigger than normal. Okay, normally it is 24 millimeters anterior posterior direction. Here it may be 30 millimeters. So your eyeball is stretched so much.
Okay.
So when the eyeball is stretched, you are bound to get small holes in the retina.
Okay.
You just imagine how it is.
Yeah.
I always tell people when I
Stretched.
explain, it's like a balloon.
Right.
When you blow the balloon, and the more you blow, it will be thinner. Okay, so from where it can give way.
Right.
Yeah.
Right.
So when it gives way and your solution is gel is become sol, that will sip and you get detachment. So detachments are very common in myopic people. First thing.
Okay.
They are also common with injuries. Now they are common also with diabetic retinopathy, untreated. Because there what happen in the vitreous, there is hemorrhage. And any blood, what will happen is scarring occurs.
Right.
So when there is scarring, it will pull on the retina. So it's like mechanically you are pulling the retina away.
Oh, okay.
So surgery is there. Nowadays it is much successful than what was in olden days. Now there are a lot of surgeries, something called scleral buckling. Then that's why initially if there are small holes, all myopic people should check their retina once. Yeah.
Okay.
People also are very hesitant.
Hesitant, right.
Sometimes when they see those black spots, they are called floaters. Then they come.
Okay.
Then we send to the retinal specialist. If there is a minor holes, something called lattice degeneration. Lattice degeneration is because it stretches.
Right.
And when something stretches, you will get small holes like. So they burn those holes.
Okay.
So I would say seal them.
Okay.
Once the hole is sealed, it's safer.
So doctor, what about cornea disorders?
You mean to say congenital?
Yes.
Not many.
Okay.
Not what I would say it's so important as corneal disorders.
Okay.
But there are some conditions like, cornea itself has 5 layers.
Okay.
So sometimes endothelium is the last layer. Some endothelial disorders, some superficial. But in congenital, I wouldn't say much.
Okay.
In adults, okay. Corneal disorders mostly will be one, if you want to very specifically mention, is keratoconus.
Okay.
Okay, keratoconus is a defect like the myopia, hypermetropia. But here the eyeball will grow in such a way, the central part become like a cone.
Okay.
That's why it's called keratoconus.
Okay.
Kerato means cornea and conus is a cone.
Cone.
And as the conus keeps on growing, it's a very interesting thing actually. People come with saying they can't see, there will be so many irregularities, you give contact lenses, they will not improve, glasses they will not improve. Then if it keeps on growing, sometimes they get small cuts on the cornea because it stretches and breaks.
Okay.
Okay, so there will be an opacity. Opacity is a white opaque thing, so the patient will not see. Understood? And in the center.
Okay.
So there you have to operate them once you get the opacity.
Okay.
Keratoplasty. Okay. That is one, and mostly it is injuries. Cornea is most of the patients who come are with injuries to the eye, especially foreign body with metal pieces, is welding pieces. But if they are removed, treated well, there should not be any problem.
Okay.
But there are some corneal conditions, like fungal infections, viral infections. If you diagnose well, then they can be treated.
Okay.
So I won't say they are something so serious. And fungal is the worst to treat. But now antifungal treatment also is available. So if the person comes early, but you have to remember that we always used to say, if a wood, dry wood touches your eye or a tail of a cow, then you are going to get fungal infection.
Okay.
Yes, because they are the source of fungus.
Right.
But very rare. I would actually, thank God, I would actually say, because when those people come, with fungal infection, we get so worried because it's like either you improve or you become very bad.
Oh my God.
Yes.
Okay.
Too bad.
Okay.
Yeah, that is one. What else you would say about cornea?
Nothing, doctor. So this is the enough of basic information actually.
Oh, yeah.
So doctor, what I would like to ask you next, and this is one question which keeps haunting me. Everyone asks me this: why don't you do an eye transplant? So I want you to explain what is eye transplant, so that our viewers know what is eye transplant, because we go literally by the term eye transplant.
Yes.
So what is eye transplant, if you could explain?
Even olden days, people used to ask me the same question. Luckily now, I don't know whether people have learned about it on Google or what.
Yeah.
Very rarely people ask. Now, after a long time, you're asking this question.
Because I want people
Yeah.
to know
No.
what it is.
Yeah. There's nothing called eye transplant. Now, literally, if you say eye transplant, people think it's the whole eyeball is removed along with the nerve.
Right.
See, they don't know. They don't know, no? The eyeball is it's like a big ball.
Yeah.
And at the back of the eyeball, there's a thick nerve called optic nerve,
Yes.
which is connected to the brain.
Yeah.
Okay? So, the moment you cut the optic nerve,
The connection is lost.
lost. You can
Yeah.
never transplant an eyeball to and
Yeah.
put somewhere else.
Because the optic nerve is the only thing that connects the eye to the brain.
And it is connected not just small area, it's connected throughout the brain.
Oh.
Right at the back, occipital lobe we call it.
Okay.
And there the signals come.
Uh-huh.
So if you
Okay.
cut it, see, even in injuries, when people have injury to the optic nerve, they are blind.
Yeah.
And
So-
now there are people whose optic nerve gets cut even with serious injuries, head injuries. I have seen people optic nerve completely gone off.
Then nothing can be done. But then what is this eye
So
transplant?
eye transplant is a misnomer actually. There's only something called corneal transplant.
Okay.
Only cornea can be transplanted. And that's also because cornea is avascular, it doesn't have a blood supply.
Okay.
That's why it can be, see, something just which has blood supply and all was not able to transplant before. Now of course other organs they are transplanting.
Yeah.
So there are conditions in your cornea. See, the cornea is very difficult, you know, for lay people to know. It's a transparent part
Okay.
of the eye. It's just like a dome shaped, which is the anterior. It's a glass. Actually, cornea is just like glass, transparent glass. Nothing. Whatever you see inside is because the cornea is transplant, untransparent. So, if your cornea is white, opaque, nothing goes inside, so you don't see.
Okay.
So, there the cornea is removed and then other person's cornea is put.
Okay.
So, only cornea, till today, only cornea can be transplanted. No retina, no iris, nothing can be transplanted. Only the cornea can be transplanted.
Yeah, I wanted people to know about it because
And
yeah,
it's
people
such-
are aware now. I wouldn't say people are not, but still there are people who are not aware about
Yeah.
what it is.
The word eye, they say, no? They should say corneal transplant.
Yes, I feel they should say. In
Yeah.
fact, even in my book I mentioned it.
Yeah.
But still, I wanted it to be vocal from a doctor. Now, so
I wish the eye could be transplanted. Actually, no?
yes,
Nobody would have been blind. Now, lens is transplanted, no?
yes,
Lenses, we remove the lens when they get cataract and we put a plastic one.
plastic one.
Understood. No?
Yeah.
Till now, cornea also they are trying. They are trying to put a plastic cornea, fish and all,
Oh.
fish scales. They are experimenting so much.
Okay.
You know, like membrane, placenta, membrane, anything transparent to put. But that is done mostly when there are corneal opacities. So even corneal transplant are two types. Lamellar. Lamellar is only few layers of the cornea.
Okay.
And then total transplant. It's also called penetrating. That is the full thickness. Okay, full cornea is not. I mean, cornea also is not full removed. That much area only.
Certain areas.
Yes, certain area. It cannot be removed fully. Whatever area of disease area is there, that much area is removed and put.
So, doctor, now that we've discussed what is eye transplant, so getting to once the cornea transplant is done, is there like a lifelong medication the patient has to take, and does a cornea transplant have like a shell life of X number of years, or how?
Basically, if your corneal transplant is good and normal, it should be lifelong.
Okay.
But sadly, many times it gets rejected.
Okay.
You know, actually it's a avascular. I mean, there is no blood supply for the cornea. In spite of that, because the tissue typing problems and all come, so many times it gets rejected.
Okay.
So it becomes opaque back, you know, to square one what it was.
Okay.
So that's called rejection.
Okay.
Okay. People have done even second time,
Okay.
but I've seen people where it gets rejected. But nowadays, with the, you know, It's much better.
Okay.
I think even in Goa Medical College.
And
they
what
are
about
doing
the
now.
medication?
There
doctor?
are medications have to be put because it's a different tissue, somebody else's, no?
Yeah.
So it has to be accepted by your body. So at least for 6 months you are put on steroids.
Okay.
Understood.
So
Drops in
So
tapering.
corneal
this, yeah.
transplant is there's no lifelong medication which a patient
No,
has to take.
shouldn't be lifelong. Once it is not rejected, then it will hold good.
Okay.
Understood. If it is rejected, it gets usually in the first 6 months.
Okay.
Understood. It becomes opaque, and again the same redness, watering, sunlight problems. So
Okay.
they remove it and they try another one.
Okay.
That also,
Okay.
then
Fine.
mostly no.
So doctor.
But that is more in penetrating. Penetrating is the full thickness graft.
Okay. Okay. So doctor, now I guess we've actually spoken about a lot of the basic knowledge which was required for us to know. Before we wrap up, any advice or message you would like to give our people, our viewers actually?
That's the best question. No, actually people have to look after themselves. You know, nowadays I feel with they're so busy in life. I feel like laughing when they come and tell. After 6 years they come to make glasses. Today itself one patient is saying, I checked my eyes 6 years back. I said either you hate the doctors or you hate yourself. No, I'm seriously
Yes.
want to tell this to public, you know.
Yeah.
Because I don't know, love yourself.
Yeah.
Only one life you have. You're not going to get it back.
Yes.
So look after your health, look after your children's health. Especially I get very disturbed when the children know, even the parents don't look after them. They give them everything, the best of things. But they'll not come to check their eyes till the school tells them. So sometimes I tell the parents, with due respect to them, they cry also, doesn't matter. I've reached that age where I can make people to cry. I tell them a teacher looks after 40 students, 50
Right.
students, still she notices that your child is not seeing well. And you have one child and you don't notice?
Right.
Okay, they are only worried about the mobile.
Right.
And screening, you know, has to be made less. This is my humble request to all the parents. Screening, viewing of the screen has to be made. Let them go out and play. You know, by 2050, 50% of the children are going to wear glasses.
Oh.
Already now must be 20. 50% they will, and the reason is they don't go out in the sun.
Okay.
They have to go out in the sun. That's the most important thing. I know protection, you know, now because the world is so bad.
Yeah.
So people don't want to send their children out. Yeah, but the sun is needed so badly every day. Actually, I tell every day. So that time they listen. And for adults, please control your diabetes and hypertension. These are the two things which kill you. I don't think there's any other disease. See, other disease, cancer, this, it's not in your hand.
Right.
Correct?
Right.
But diabetes and pressure, it is definitely in your hand, especially diabetes. No,
Yes.
they will not control. If you tell them to go and do your retinoscope, this, you know, check your retina, they will not. They come at the last stage. Actually, when everything is lost and nothing can be done, then they are spending lots of money, you know, lakhs of rupees for those injections. Now we give injections for the retina, no? The retinal specialist. Every month, every two, not a simple 24,000. In lakhs they spend. Yeah, don't spend that money afterwards.
Take care of yourself.
First, you take care of yourself.
Yes.
You know, like they have the habit of saying, "Oh, I didn't have anything to eat when I was small, doctor."
So it's like prevention is better than cure.
Yes. Especially diabetes. We in Goa, we see every second patient is diabetic, but there are a lot of diabetic retinopathy people, and you know, like we feel more upset than them because we feel even we can't do much afterwards.
Right.
Understood, no? So
Yes.
this is my sincere advice to adults and to children, of course their parents.
Yes.
I can't give the children.
Yeah.
Understood, no?
Yeah.
Mobile has to be limited.
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 So, doctor, thank you so much for your time.
Yeah.
Thank you so much for making it.
Welcome.
And thank you for giving us such a knowledgeable session. And I hope you had a good time.
Yeah,
having this
wonderful time
conversation.
because I like to talk.
Thank you so much, doctor.
Hope you enjoyed watching this video. If you found the video informative, don't forget to like, share, and subscribe to our YouTube channel. Also hit the bell icon to keep up with regular updates.